Models in Oregon's efforts to flatten the curve of COVID-19, we found out may also be working.
Yeah, health officials are cautiously optimistic. The rate of infections has slowed. That would allow hospitals to withstand any spike in patients. Jennifer Dowling live tonight with more on what the health experts are saying. Jennifer?
Good evening, Jeff and Jennifer. Well, they say a new model is taking Oregon's social distancing practices into account, and it shows that there could be a gradual enough curve upward that all the medical professionals, if things remain status quo, will be able to handle all the patients that need care.
The state has been doing the modeling and predictions for Oregon. I think there's room for some optimism.
The Oregon Health Authority says new research models show that Oregon's quiet streets and warning signs are making a difference. Health officials say the stay-home order and social distancing may have put a big dent in the transmission rate of coronavirus.
They are one of our best tools for slowing the spread of this virus and avoiding a situation like we've seen unfold in Italy or New York right now.
Health officers say models from the Institute for Disease Modeling in Bellevue, Washington show that if people continue to follow these rules, Oregonians will not overwhelm hospital beds. This graph from OHA and IDM shows the impacts in more detail. If everything went back to business as usual, as indicated by the blue line, Oregon would need nearly 400 hospital beds by May 1st. If the order stayed in place and people comply as indicated in orange, Oregon would need less than 200. The green line shows that if transmission is reduced by another 30%, the state would need even less.
Our Institute for Disease Modeling really takes into account the picture on the ground here in Oregon, the measures we took in place, and gives us some confidence in what it says going forward.
Dr. Seidlinger says transmission appears to have been cut by as much as 50 to 70%. Although health officials are cautiously optimistic, Dr. Vines is still planning for the worst because of so many unknowns.
What if the picture is not as rosy as we think it is? Given that we think that there's been some benefit to the measures that we've put in place so far, what does a worst case scenario still look like?
And critics say that one of the things that these models aren't taking into account is the fact that not everyone has been tested because of a lack of available tests for the coronavirus. So we don't really know how many people have had it in the state of Oregon. Also, a thing that could affect the gradualness of the curve upward is the fact that health professionals could run out of personal protective equipment in the battle on the front lines against coronavirus. Back to you.
Jennifer Dowling live for us tonight. Thank you.